Bringing better health to life. This program is brought to you by Conway Medical Center, and I want to introduce you to Dr. Frank Cuoco. He is affiliated with MUSC, but he's also affiliated here at Conway Medical Center. So let's start with that. Would you explain how you work for both hospitals?
Yes, my name is Frank Cuoco, and I'm assistant professor of medicine at the Medical University of South Carolina. My specialty is cardiac electrophysiology, which deals with abnormal heart rhythms in patients with cardiac disorders. So I'm a specialized cardiologist who focuses in abnormal heart rhythms. I spend most of my time down at the Medical University of South Carolina, but one day a week I come up here to Conway, where I see patients at the Waccamaw Cardiology practice with Dr. Gresko, Weish, and Rosenblum. And in their office, I see patients with a variety of heart rhythm disorders, and including I follow patients who have defibrillators and special types of pacemakers for heart failure. I also see patients in their office for consultations who have abnormal heart rhythms, and here at Conway Hospital I'm able to implant those defibrillators and special pacemakers for heart failure right here in the hospital. So I have hospital privileges here as well.
Frank, let's start with the topic of irregular heart rhythms. You think of that as an older person's disease, but there are a lot of younger people who have this problem.
Absolutely. There's many different kinds of heart rhythms that are associated in patients without heart disease, and in others who do have more serious heart disease like coronary artery disease or congestive heart failure. In younger patients who don't have significant heart disease, they can have abnormal fast heart rhythms that we call SVT, which is short for supraventricular tachycardia, which means they have rapid heart rates that are due to little short circuits that form in their heart. Also, the most common heart rhythm disorder is atrial fibrillation, and that can affect patients from age 20 to age 80. It is more common in older age, but more and more younger patients now are developing atrial fibrillation, and we now have new drugs and interventions and procedures that we can use to treat this heart rhythm disorder.
I'm sure there's people from time to time who all feel that their heart is racing, but how do you know, there's a problem, I need to see somebody?
Okay. Well, if you have symptoms of what we normally think of palpitations or heart racing, it's probably good to start off by seeing your internist. They'll probably do a basic EKG to make sure that the rhythm is normal just at baseline and there's no abnormality on the ECG that suggests a heart problem. And then from there, they may refer them to a cardiologist, like the group at Waccamaw Cardiology here at Conway Hospital, where they may order some specialized tests to look at the heart muscle function, or do a stress test to see if there's any stress-induced problems with the heart, or evidence that the heart isn't getting enough blood supply, there's blockages in the arteries. And mostly what they'll probably do initially is have you wear an outpatient heart monitor, which will then be able to record the heart rhythm. And it may be a specialized monitor that monitors you for 24 hours continuously, or a monitor that is triggered by the patient to detect an abnormal heart rhythm, and that can actually document these abnormal heart rhythms and show what's going on at the time of the patient's symptoms.
If a patient had an irregular heart rhythm, does this usually happen during exercise, fast movement, or is it a lot of times when they're sedentary? It's
very patient dependent. Some patients will have exercise-induced or stress-induced arrhythmias or abnormal heart rhythms, while other patients can have symptoms just at rest, or even more when they go to lay down and sleep. It can be quite variable what triggers the patient's rhythms. And sometimes patients have no specific triggers at all, which will happen at random times during the day. And these symptoms can be very short, or they can be very long and lasting.
We'll talk about pacemakers and defibrillators in our next segment, but we have about a minute to go in this segment, Dr. Cuoco, and so I want to ask you this. We hear of Coumadin. We hear of that being usually prescribed for somebody with irregular heart rhythms. Is that still a pretty prescribable drug for this disorder?
Well, in patients with atrial fibrillation, we worry about their increased risk of stroke. That is because in patients with atrial fibrillation, blood clots can form in the upper chambers of the heart, and these can break off and cause strokes. So patients with certain risk factors for stroke, like high blood pressure, diabetes, heart failure, and a variety of other conditions, will predispose them to stroke if they have atrial fibrillation. And those patients usually are candidates for blood thinners like Coumadin. In fact, actually, there are new drugs that have just become available and are FDA approved, and other drugs that are coming out particularly one currently called dabigatran, or otherwise known as Pradaxa, that does not have a lot of the problems that Coumadin has with interactions with diet or other medications or needing for frequent blood tests and monitoring. So we're going to have lots of new options for blood thinners. Additionally, down at the medical university, we're going to be starting a protocol to actually prevent strokes and blood clots from forming in the heart by implanting a device inside the heart that prevents strokes from forming in one particular area of the heart that we worry about in atrial fibrillation.
Wow, that's amazing. We're going to take a little break, but I want everyone to know that we will return in just a moment to show a little defibrillator and talk about pacemakers and who needs them. We'll be back.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
We're talking with Dr. Frank Cuoco of MUSC, who's affiliated here with Conway Medical Center. And you actually come up here one day a week, and I understand that you work along with Waccamaw Cardiology and help to install, probably that's not the right word, pacemakers as well as defibrillators.
Yes, that's right. We actually do implant both
Implant's
devices.
the word.
Yes, we do implant both types of devices here. In fact, the doctors at Waccamaw Cardiology, particularly Dr. Gresco, puts in pacemakers, which are specialized devices that are now about the size of a quarter that are used to treat slow heart rhythms. I come up as a specialized doctor who specializes in arrhythmias, and I actually implant a little different device called a defibrillator. This is an example of one here. These types of devices are usually implanted in patients with more severe heart disease, and they can treat both slow and fast heart rhythms. They're implanted to prevent sudden cardiac death in patients who are at high risk for that.
Now, I know the pacemaker is just put right under the skin. How about the defibrillator?
Same, and this actually goes in just as simply as a pacemaker does. The only difference is it has a specialized wire that can shock patients out of cardiac arrest. So it's sort of like having your own portable defibrillator that's with you at all times, monitoring your heart. We also implant specialized types of defibrillators called cardiac resynchronization, or CRT devices. A lot of patients with congestive heart failure have electrical delay in their hearts, such that one side of the heart beats earlier than the other. And by putting in specialized pacemaker wires on both sides of the heart, we can actually resynchronize and improve the contraction of their hearts. This has been shown in patients to improve the heart size, improve the heart function, make patients feel better and keep them out of the hospital, and prevent sudden death.
You came in with a piece of paper here, and you told me that this reflects the progress of a patient.
Yes, actually, this was a patient that we implanted here at Conway Hospital in July of last year. He had blockages in the arteries of the heart and had prior bypass surgery and had congestive heart failure with really minimal symptoms of heart failure. He's very functional. He rides a Harley motorcycle every day. And in fact, when he came to see me today, he had already gone hunting yesterday and the day before, despite the cold weather. He's very active, but because his heart muscle function is weak and he had scar in his heart, we were concerned about his risk for sudden death. So we implanted this defibrillator before he had any known heart rhythm problem. About 4 months after his defibrillator was implanted, while he was asleep, he had a sudden and potentially fatal heart rhythm. The device detected it and actually shocked him back into normal rhythm. Ironically, he didn't even feel this because he was asleep and unaware. I told him today that the device saved his life and he didn't even know it. But this is exactly why we're implanting these devices here. Patients are at risk and they don't know it. And otherwise, someone who would have died in their sleep is now able to continue to go on living a very healthy and functional life. And that's really who we're focusing on implanting these devices in here, those who are at very high risk, who otherwise would go on living a very functional life.
And obviously, a patient finds this out from seeing their internist first, who in turn recommends them to a cardiologist, etc.
Right. I think it works best when the patients see their internist and or their cardiologist first. And then the cardiologists really know, especially here at Waccamaw Cardiology, are very, very in tune with the indications for patients who really will benefit from these defibrillators and special types of pacemakers, as we said, the CRT devices for heart failure. In fact, the group here is actually very, very aggressive at making sure all their patients who really are going to benefit from these devices are going to get them. And the great part is we can do them right here at Conway Hospital, 99% of the time.
In one day, out the next?
In one day and out the next. Really, and our success rates here have been as good as any university center, and the safety and the staff here are very, very well trained. I enjoy coming up here weekly to do these.
Dr. Cuoco, thank you so much for being with us today.